Good morning, everybody. Can you hear me okay? Thank you very much for joining the second of this year's Pitching for Partnerships sessions. This is a brand new format that we have for the CGI annual meeting, and thank you very much for joining us here. As you know, the theme of the CGI annual meeting this year is mobilizing for impact. And your goal, everybody here in this room has the goal to help our pitch makers who are here over to my left. And I'm going to ask them just to stand for a second, if you will, pitch makers. We are going to take advantage of CGI's platform to help them find partnerships and resources. And it's your job, please, to assist them at the end of this session. Okay? You're going to hear 5 pitches. You may sit down. You're going to hear 5 pitches from 5 CGI commitment makers. They are terrific. They've been through a process whereby more than 30 CGI commitment makers applied to be part of this program here. We saw the first 5 of the successful ones on Tuesday morning, and here are the other 5 today that you will see. They were judged against a series of standard criteria, including proof of concept, potential for scale and impact, quality and breadth of partnering opportunities, and innovativeness of approach. So congratulations, pitch makers, for making it here this morning. It was a tough choice, 10 in total chosen, and they will be put through their paces by our panel of experts who are over here. Are you ready, panelists? There they are. Yes, they're hiding in the dark over there. They are ready to pounce on our pitch makers with some difficult questions once the pitches have been made this morning. After that, it will be your turn. We'll have some networking time with the individuals, and I'm going to keep my remarks, therefore, very, very short right now. So I'm going to actually just introduce very quickly our 3 panelists, if I may. They are Jacquelline Fuller, who is the Director of Google Giving at Google, who's in the middle here, and we have James Mwangi, who is Global Managing Partner from Dalberg Global Development Advisors, and Linda Rottenberg, who is Co-Founder and CEO of Endeavor Global. Will you welcome our panel, please, this morning, everybody? Alrighty, on to the pitches. I'm going to invite the first of our pitch makers up to speak with us this morning. His name is Crispin Murira. He is the Chief Executive Officer of Copia Kenya. Crispin.
Thank you, Rex. Allow me to tell you the story of Wanjiru and Lucy, 2 women living at the base of the pyramid whose lives have been significantly enhanced ever since Copia began operating in their village. Wanjiru is a Copia customer. Lucy is a Copia agent. You see, Wanjiru and Lucy may live on $2 a day, but just like any Western family, they must buy goods to meet their family's day-to-day needs. But due to their low purchasing power and the poor infrastructure in the areas where they live, mass retailers who have buying power tend to neglect them. Wanjiru therefore has to travel miles and miles, often walking, to get these products. Or, if Lucy has managed to stock them in her shop, Wanjiru has to pay a much higher price for the same goods than her wealthier counterparts living in the cities. There is something incredibly unfair about that. Worse still, single product manufacturers manufacturing fantastic life-enhancing products, such as energy-efficient stoves or water purifiers, have a difficult time reaching her. Copia is changing that. Wanjiru now shops for all her basic necessities from Copia, getting quality goods at reasonable prices right in her village. Today, she is making her final payment for an energy-efficient stove. Lucy, without buying inventory, has significantly boosted her income. She no longer worries about how she will pay school fees or buy books for her 2 children. Someone once said that men lie, women lie, numbers don't. We have served over 1,000 customers since we began operating in less than a year. We have increased the net income of our agents by over 57%. We have sold products over $200,000. The potential is enormous. What is Copia? Copia is an innovative demand aggregation distribution model that uses mobile technology and catalogs to enable small kiosk owners at the base of the pyramid to serve the local population with a wide variety of quality goods at non-exploitative prices. Customers browse the catalog, place orders at the agent's kiosk. The agent uses their mobile phone to send a specialized text message order through a system that we developed. We receive the order and fulfill it, delivering to the agent's location within 48 hours. Simple. Aggregate demand, lower per unit distribution costs, provide convenient, affordable access to goods, all of which improve lives, many of which are labeled socially beneficial by the West. Our commitment is to use this model to reach 200,000 Wanjirus by the end of 2014, and thereby change the lives of 200,000 families. My name is Crispin Murira. I moved back to Kenya last year after 20 years in the United States, schooling and working at some of the most prestigious institutions, simply because Wanjiru is my aunt, she is my cousin, she is my grandmother. To help achieve our goal, we're looking for supply chain, operations, delivery, and logistics experts to serve as senior level advisors to the company. We currently also have a convertible note open for the funding of our expansion phase. Thank you.
Okay, oh, there we are. Our second speaker, thank you very much, Crispin. Our second speaker is Sashi Shenoy. She is the co-founder and executive director of Upaya Social Ventures.
Thank you, Rex. Upaya creates dignified jobs for the ultra-poor in India. We invest in scrappy entrepreneurs like Sunil, down here at the bottom, and help them build businesses that create jobs for women like Suman. We believe even the poorest of the poor can lift themselves out of extreme poverty if they are given the right opportunities. Take Suman, for example. For years, she was considered the poorest member of her village. Her neighbors called her the charity case. She, her husband, and their 4 children would go to construction sites hoping to find work every day. And on a good day, they would make only 75 cents for their efforts. Suman told me she struggled every single day to find work. So is it any wonder that this family of 6 lived in a mud hut and ate 1 meal a day? Walking distance from Suman's village lives a man named Sunil. Now, Sunil is better off. His family owns a few cows and he sells the milk for a living. But Sunil always dreamt of owning a much larger dairy farm. The problem was, who would fund him? He was considered too affluent, too big for microfinance, but too small for traditional banks and investors. And that is where Upaya came in. We invested in Sunil. We helped him write a business plan, purchase equipment, assemble a team, and really helped him create a large-scale dairy operation. Today, Sunil's dairy farm generates over 2,000 liters of milk every day and has employed over 300 women just like Suman. In fact, Suman was his first employee. This is Suman's first stable job. She has tripled her salary. Her children no longer have to work on construction sites, and they are attending school every day. She is no longer the village charity case, I'm happy to report. And there are 300 other women like her that are climbing out of poverty right now, thanks to their jobs at the dairy farm. Upaya in Hindi very simply means solution. We have created business solutions to fight extreme poverty. We have invested in 3 entrepreneurs like Sunil, and they have all created over 500 jobs, all in the last 18 months. We are now committing to double our portfolio in the next year. We have a fat pipeline of small businesses in our, that really need funding. We are seeking your support in helping us fund these small businesses, and we are also seeking media support to help us raise our profile. Yes, we take on risk. Yes, some of our businesses may fail, but others will take off, scale up, attract more investment, and create badly needed jobs. I hope you'll join us. Thank you.
Thank you very much. Thank you, Sashi. Okay, next up we have Amanda Gutierrez, who's a research assistant of Rice University Beyond Traditional Borders.
Thank you, Rex. Every 4 minutes, a woman dies from postpartum hemorrhage. 99% of these deaths occur in the developing world. This means that by the end of this speech, another woman's life will have been claimed by this condition. Postpartum hemorrhage is characterized by severe blood loss after childbirth. The good thing is that the vast majority of these deaths are preventable. Yet too many medical providers around the world lack the effective tools to diagnose this condition, making it even harder to combat the problem. Current methods of visually estimating blood loss include the Chuck's pad and a plastic cone-shaped bag commonly used in hospitals in the US. These methods are inaccurate, subjective, and inconsistent. Inaccuracy in blood loss estimation can lead to death for many women suffering from postpartum hemorrhage because the condition may go undiagnosed or they're not properly treated for the amount of blood volume that they've lost. There is a desperate need for a low-cost, simple diagnostic tool that is accessible to hospitals in low-resource settings that can not only signal postpartum hemorrhage, but also aid doctors in determining exactly what medication and treatment the patients need. Luckily, students at Rice University have developed a solution. It's called the SafeMat. This is the SafeMat. The SafeMat is more accurate than these other methods of visual diagnosis. It's low-cost, sterile, disposable, and easy-to-use diagnostic tool that accurately and quickly detects postpartum hemorrhage. It provides a visual estimation using these grids where each square contains a certain polymer called superabsorbent polymer, which is the same polymer that's used in diapers and sanitary napkins. Each square will absorb, when completely saturated with blood, only 50 milliliters of blood. Thus, the healthcare provider only needs to count the number of squares to determine how much blood volume the woman has lost. The innovative thing about the SafeMat is that it not only signals the event of a hemorrhage, which is 500 milliliters or equal to 10 squares in the SafeMat, it also tells you within 50 milliliters of accuracy exactly how much blood the woman has lost. Results from preliminary research have been incredibly positive. We've surveyed 150 people, and we found that participants are 95% accurate when using the SafeMat in blood loss visual estimation in comparison to only 45% accurate when using an unguided estimating tool like the Chuck's pad. These slides are examples used in the visual survey. The first is blood as viewed on a Chuck's pad, 500 milliliters, and the second is 500 milliliters on the SafeMat. This summer, in partnership with the Baylor College of Medicine, the SAFE team began clinical research that is proving the mat's efficacy and showing similar results. However, what we need is manufacturing partners. Right now, these mats take 3 hours for myself and other students at Rice University to make. In order to improve maternal health and achieve the Millennium Development Goal of improving maternal health and lowering maternal mortality by 2015, we need to scale up this project, and we need someone who is experience with making paper disposable products to help manufacture these so that it reaches all women who really need this device. Thank you.
Nice job. Thank you, Amanda. So next up we have Elad Orion, who is the co-founder and general manager of Comet-ME.
Thank you, Rex. For all of us, the use of electricity to power everything we use is so basic we don't even notice it. But imagine living in a cave without electricity in the mountains of one of the world's most contested regions, when an expensive and dangerous kerosene lamp is the only option to light your house, when storing food is an impossibility, of having no communication with the rest of the world and using only the power of your own 2 hands to do every chore. For the people of South Mount Hebron in Palestine, like Hajj Nusha that you see behind me, and another 1.6 billion people around the world, that is their daily reality. And that is the challenge we have chosen to tackle. Since 2007, Comet-ME, a group of Israeli and Palestinian physicists and technicians, has built 25 wind and solar installations that now power the homes of 2,000 people, using only clean, renewable energy. At the core of our methodology lies the notion that we provide valuable service to the communities with which we work, and that it is our role to do so in a sustainable manner. This is why we are much more than a technical implementation agency. We lead projects from conception to completion. Community involvement, fundraising, system design and construction, and long-term sustainability are all done in-house. Our work is neither proof of concept nor a demonstration project, but an operation meant to provide a whole region with decentralized renewable energy supply. Now, here's what you can do to help. If you're doing advocacy work here in the US or abroad, We need your help to overcome the political challenges we face in a contested region like ours. If you implement similar projects in other parts of the world, we would like to learn from your experience and work with you to enhance our model. We're also looking to expand our work to other parts of the West Bank, Gaza, or the rest of the world. If you fund projects in the developing world, we would like to partner with you to connect more people to clean energy. Let me finish by quoting Haj Ribhi, an elder of the community of Sha'ab al-Butum, describing the impact of the electricity we have installed in his house. He said, "It was like water for the thirsty in the middle of the desert." Thank you very much.
Nice job. Thank you very much, Elad. And our final speaker this morning is Elizabeth Hausler-Strand, who is founder and CEO of Build Change. Elizabeth.
Thanks, Rex. On January 12, 2010, Oramin Lamar's house collapsed in an earthquake that killed her neighbors and her friends. She was alive, but she was homeless. She had nowhere to go, so she moved her family of 6 into a tent camp, where nearly every night women were raped, cholera was a constant threat, and clean water and basic sanitation were a dream. Her family fell into a downward spiral. See, Oramin ran a sewing business out of her home, and she didn't have the safety or security or space to restart it in the tent camp. So when we met her, she'd been living in the tent camp for 2 years and thought she would spend the rest of her life there. But our Haitian engineers checked her house and determined that it could be retrofitted, it could be saved, repaired and strengthened so that it could withstand the next earthquake at a cost much lower to building a new house. So Oramin's family worked with our engineers to design and build a safe home, and within a few months, she moved back in and she's back to work as a seamstress. So why is Oramin's story different, and what makes the build change approach innovative? Well, we don't believe in temporary or transitional houses. Oramin is in a permanent house that will last for years. But unfortunately, so much of the money that was spent in Haiti and is spent on disaster relief in general is spent on these short-term fixes. And this is why President Clinton said yesterday in the Haiti session that housing is the one thing that takes so long after a disaster to recover. But this is because we waste so much time on temporary solutions, and we do have the solution. We don't give houses away. We stretch donor dollars further, and we mobilize for impact by empowering people, especially women, with the knowledge, technology, and financial incentives to rebuild the house they want and to take control of their lives. When women make decisions about housing, they prioritize safety over size. So Oramin is just one. Build Change has worked with 80,000 earthquake survivors in Indonesia, China, and Haiti. Build Change was the first organization to implement these permanent housing solutions in Haiti in partnership with other CGI members like Chord8 and JPHRO. So I'm Elizabeth Hausler-Strand, the founder and CEO of Build Change. And like the Clinton Global Initiative, we'll be turning 10 years old next year. So we've set an ambitious goal of bringing safe housing solutions to 1 million people in the next 10 years. So let's work together to support more homeowners like Oramin with safe housing solutions, to work with governments to develop and implement easy-to-use building standards, to extend credit to homeowners who commit to following those standards, to use microinsurance as an incentive for safe construction, and to expand throughout Latin America to retrofit buildings before the next earthquake. And last but not least, Build Change has created something like 5,000 new jobs in Haiti. So let's work together to create more jobs building safe homes. Thank you.
Terrific. Thank you, Elizabeth, very much. Thank you. Okay, will you join me in thanking all our pitch makers this morning? Great job. So this is the moment where we turn the light on to the experts, one of whom is disappearing around the back of the room, but there we go. So she'll be back, we hope. What's going to happen to our... our shoeless experts over here. Could you all remove a shoe, please? What's going to happen next is that we're going to ask our experts to ask a question of the pitch makers. Each will come up on stage. We're going to ask Crispin to come back up on stage and join us right here, right now. Crispin, let me give you a microphone. There you go, sir.
Thank you.
So they will ask Crispin a question which will help clarify the situation, and after that we'll ask the expert to give us a little bit of their own commentary on what they think would be a very good way, perhaps, of helping this particular pitch maker with a partnership or other ways that might clarify the ask. Okay, so Jacqueline from Google Giving, over to you.
Sure. So very impressive pitch. You're impressive personally as well. You're a great storyteller. My question is around demand. And, you know, there's been a lot of efforts for socially beneficial products. And one of the things that we've seen with other efforts is that supply is not necessarily the challenge, or distribution, but actually sustainable demand from the public. So I wanted to just ask and see what your data is showing you to date, and if demand is a bit softer than you'd like to see, if you're considering other models that, you know, perhaps including other things in the catalog that might be a little bit of maybe mac and cheese to the broccoli.
And thank you. That's a great question. I tend to look at it fairly simply, which is if you build a distribution channel that has a lot of products going through it, what you do is that you lower the per unit distribution cost of everything that goes into that channel. And therefore, we are not, you know, we sell hammers, we sell bicycles, we sell stuff that people naturally know that they want. What happens is that in the long run, what the products that we deem socially beneficial, whether it's solar lamps or energy efficient stoves or whatever, if you've created a channel that makes it that people trust, it makes it easier for you to put products in that channel and lower the cost of distributing it. And on top of that, what we're doing with an electronic catalog project that we're creating is we're enabling this endpoints where somebody comes in just to buy something that they're really comfortable with, and they're able to watch a product video for a socially beneficial product, and that lowers the cost also of educating the public on those kind of products.
So you're doing a little demand creation through the videos in the shops as well.
Correct.
Yeah. Can I ask another follow-up?
Sure.
Just wondering about, you know, the M-Pesa system in Kenya is so impressive and is enabling so many different innovations from, you know, health to business. I'm just wondering about potential for scale, and how do you see this operating in regions where mobile money is more difficult?
Yes. I mean, I think Kenya in and of itself is a huge market, and so is East Africa. And what we're seeing is that in the long run, you're right, that other areas do not have as great a mobile payment system as Kenya does, but it is spreading. And we feel like in the next 4 or 5 years, we will be in a position to expand to other countries that don't have that system very well. But just in East Africa by itself, we see that there is a spread of M-Pesa and M-Pesa-like payment systems, which tells us that there's a whole market there that we can tap into.
Great. So a little commentary?
Please.
Yes. All right. So to summarize what I think your value proposition is for the bottom of the pyramid consumer, it's getting needed goods at a fair price, and then in a place, delivered to a place that's convenient for them, not having to take the bus into the city. And then for your agents, I think this is where a lot of your innovation is for your agents, they get additional products, but they might also be developing a trust relationship with consumers that is going to enable them to sell more product, and not just your products maybe, but even everything that they have on offer.
Correct.
Yeah. So I think that that's a strong value proposition. My commentary would be, you know, I come from Silicon Valley and the tech industry, Google, and we really believe in a launch and iterate model, because I find that the best laid plans and pen and paper are on tablet. Sometimes consumers just befuddle, you know, and I think that this is particularly true when it comes to social goods. You know, we have a whole lot of data showing that even if cook stoves will save lives and save money and cost less over time, the demand is still a problem. So just an encouragement that your basic model looks terrific, but a launch and iterate model where you are doing rapid innovation and just tracking what's working and what's not might be a good approach there. And then in terms of thinking of partners who might be particularly interesting, you've stated equity, so you're looking bottom line for investors, and I think that that's pretty clear and should be attractive to a lot of folks. And then you also mentioned supply chain, operations, logistics, delivery. I will talk to you after. I think that that's a really rich area to look at, and if you're open to doing some iteration on your model or even trying some A/B trials, it might be interesting to see what happens if you piggyback off of someone with a established distribution channel, and try to iterate a little bit on your model and see what might be more effective if you go out with, say, a company that has already established a strong supply chain and customer relationship and distribution network, and piggyback on top of that versus doing standalone. Could be some interesting partnerships.
Okay, great. We're always open because I don't believe that anyone knows everything, and so if there's any ideas that we can modify our model with and make it better, great. Thank you.
Good, thank you, Crispin. Thank you, Jacqueline, very much. Good, so I'm going to ask Sashi back up on stage from Upaya, and Linda, you're up next. I will ask you just if you will keep your comments fairly brief because we want to get into networking time as well. So thank you very much. Thank you.
Okay, so I have a two-part question. One is, are you providing mentorship in addition to the funding? So if people here wanted to act as mentors, how could they and how could they? The other is, I'd love to know the amount of the size of the loans you're giving to these businesses, and is there a repayment model? Do you expect at some point to be self-sustaining or at least to have some sort of revolving loan with people paying back?
Sure. Thank you, Linda. So to the first question, yes, we do provide mentorship. We think that is absolutely critical for these entrepreneurs, given that many of them have not had advanced degrees or necessarily really have experience in entrepreneurship. And so I have a fully dedicated team in India that works alongside them, and we give them support for at least the first 2 years. So we're just working with them to prototype and make sure their model works. As for people here that are experts in those sectors, they can absolutely get involved. We've done video Skype chats. We've connected entrepreneurs in even far-flung regions, and a lot of our mentors here have found that beneficial. To your second point, on average, our investments are about $25,000 or so. Right now, we are actually experimenting with an equity model and not loans. But what we do is we put a buyback clause in, and we say in a 3 to 5 year period, we would like the entrepreneur to make his or her best effort to buy out our stake at that time. And most of our entrepreneurs are actually working towards that because they want to be full owners of their company. So we do hope to make market returns and then recycle whatever we make back into new investments.
Well, I think that you mentioned media awareness, and I just wanted to say I'm a huge believer in gaps, and I perked up when you said we're solving the gap between microfinance,
yes,
and the traditional banks. So I was like, how does this differ than microfinance? You answered it. So I would say, first of all, I think you have a great story. I think the ability of sustainability and scalability and gaps is something that's very important to tell. But I would say, even in addition to the media partnerships I hope you'll find here, even just taking on the iPhone or an Android, just the stories, not only of the entrepreneurs, but of these women and the jobs and the change in their lives is so compelling, and just putting that out on the web. I actually think there's a lot that can go viral, and you have such great stories, even with these 3 entrepreneurs. Hope you're going to double them soon. So I just encourage you to even start your own story and not wait for the big media partnership. Right?
Sure, will do. Thank you so much.
Great feedback. Thank you very much. Thanks, Sashi. Okie dokes. Amanda, if you'll come back up on stage, we're going to ask you, Jacqueline, if you will have a chat with Amanda.
So super compelling topic. I mean, when you start out with the statistics, it grabs everyone's attention. So one clarifying question. So as you said, most of the deaths, maternal mortality, occurs in the developing world. But unfortunately, many of the births there are done at home without skilled attendants. So what piece of the problem would the MAT address in the developing world? where you could measure the blood loss, but is there going to be anyone there to do anything about it if they measure it accurately?
Yes, thank you. Great question. Okay, so we currently, the Rice University Beyond Traditional Borders program currently is partnering, our biggest partner is the Clinton Health Access Initiative in hospitals in Malawi, which is where we are hoping to do field testing when we get IRB approval at the beginning of next year. So the SafeMat would be part of a maternal health program, essentially, that we are going to work with CHI, Clinton Health Access Initiative, through. And essentially, so this mat, it is very implementable in the U.S., but it was made for the developing world, which means that it was made to fit, if births happen on the floor, the mat fits perfectly on the floor. Now, we're trying to work, after the clinical study, to work with CHI to develop a program where, because currently CHI ships out things like Chucks pads, they'll have OB-GYN packs that they'll ship out to, they'll give to midwives who live in the communities, rural communities, that go and actually help with the home births. Of course, we have to work on this to work on the reach of these midwives and of teaching them how to use the mat, and also work on shipping the mat in addition as part of this OB-GYN pack, as part of this birth kit that a lot of the midwives get to go to do the home birth. So it would be part of a program, but this is the preliminary stage. Of course, we have to manufacture it first, and I ran out of time, but of course the other really key thing that we need is, in addition to manufacture, is we need people like CHI who want to use it. Even if you're not a manufacturer, you're part of an advocacy program, you are really interested in maternal and women's health, we need you to fund this. That's the key to the success of this project.
Well, I think you've got a really compelling offering because when it comes to, let's just be crass and let's talk about, when it comes to PR, who does not want to be about saving mothers? And when you save the mother, you save the baby as well, right? So super compelling narrative, I think. Just a couple thoughts for you around getting your manufacturer and getting the word out. It occurred to me when I gave birth, there is never a moment where you're more emotionally in touch with just the power of motherhood and just the preciousness of life. I would hit up moms in that moment in the developing world. And, to be a little bit crass again, we have the TOMS model where we're doing, you buy shoes and you send a shoe. Maybe a partnership for those of us in the rich world where you go in, you give birth, you're so grateful for the opportunity to have a healthy birth. That's a great moment to send that kit that your Matt will be a part of. So maybe a partnership that way is something to consider.
Thank you very much.
Very good. Thank you so much, Jacqueline. Thank you, Amanda. Terrific. Elad, if you'll come back up on stage. And we're going to ask James Mwangi from Dalberg to have a conversation with Elad.
Elad, thank you so much for your presentation, but frankly for what you're doing. I think the context in which you're doing this and both the ingenuity and innovation about it, as well as just the context in which it's operating is just inspiring. So thank you for that.
Thank you.
I had a question for you that's going to focus on the economics of this, because a lot of the question around energy boils down to economics. Do you have a sense of how the mini grids, in terms of the cost of energy delivered, compare to what households are incurring in either real or implicit costs for alternative sources of energy? And is there a positive gap, or is it more expensive energy right now?
So, first of all, I have to say that the context in which we work, that of Palestine, is probably very different from many other parts of the developing world, because politics plays such a huge role in the area and in what we do. Yeah. So a lot of the work that we do, although it has obviously a universal reach and universal appeal, a lot of it is based on very local, idiosyncratic politics, which is an attempt to support communities in their struggle to stay on their land against an attempt by an occupation force basically to remove them from their land. So in this respect, cost is a different consideration. I would say that at the moment, the positive impact on families' income does not cover the cost of installation. But this is very specific to what we do in Palestine. I do believe that it has basically, mostly through scale, potential to be much closer to zero, the gap in larger places where politics does not play such a huge role and where actual implementation is easier than where we work.
Great. So I think it does complicate the story a lot in some ways, because what we found in other places looking at the question of energy poverty is that the poor, whether they're using kerosene or walking to fetch charcoal, or typically pay a lot more for energy than people who are connected to the grid in general. Be that as it may, you talked about the need for funding, and I think there might be an opportunity to consider differentiating that a bit, and maybe you're already doing that in terms of saying, at the end of the day, there is some value attached to energy. It's the baseline commodity for economic activity of any kind.
For sure.
And so is there a way to split out, maybe thinking about tiered capital structures, where on the one hand, we're saying there is some grant funding that will flow to, just addressing the market challenges of being in Palestine, but then also looking at, at a certain layer, can you bring in either impact investors and over time creating the investment case that, 5-10 years from now, this transitions into being what energy should be, which is a competitive space where people are bringing in new and scaling solutions.
I'm not going to give you time. We need to move on to networking. So I apologize. But great question. Thank you very much, Elad. I'm going to ask Elizabeth up now. So
we'll continue the
Thank you very much. Yes, please talk afterwards. Please do. Elizabeth, come on up if you will. Linda, over to you.
Great. I love build change, by the way. It's very empowering. So you've been doing this 10 years. You mentioned to me that you're hoping to expand elsewhere in maybe Latin America. So to make it successful in terms of replicating in another country, what could people here or partners do? And if people wanted to support you back in Haiti, what's the cost of retrofitting one home? What's a meaningful amount of support that would help you just expand what you're doing in Haiti? So that's a two-part question.
Got it. Yeah, I'll take those are two great questions. I'll take the second one first about Haiti. So, we're retrofitting these buildings in Haiti, and the cost is between $500 and $3,000, which really is not that much money. And the $3,000-$4,000 on the higher end, there we're talking about multi-unit, multi-family buildings. So not only are we creating a situation in which the owner can go back to their home, but also we're putting rental units back on the market. And so if you know anything about Haiti, there's really a dearth of housing in general before the earthquake. And so we're meeting the needs of the homeowners that were immediately affected, as well as the rental population. But we don't actually give that money out. That money usually comes from partner agencies. And so right now in Haiti, we're trying to provide access to microfinance for those homeowners so that they have access to financing with strings attached, right? You can't get the financing unless you follow what we're saying about earthquake-resistant design and construction standards. But there's also some benefit to doing that. Like, we're trying to work within the microfinance community to provide access to a lower interest rate if people agree to follow building standards, because we're usually operating in environments where the government is still building its capacity to enforce standards themselves. So in Latin America, this is very exciting because we're going to be working before the earthquake happens to try to prevent these disasters from happening in the first place. And again, we're looking for seed funding to get our programs off the ground. But really, again, this is going to be a microfinance and microinsurance partnership where we're working with lending institutions, which could be cement companies, they could be traditional microfinance institutions, they could be insurance providers, where we're working together to create a bundle, to create a package of financing incentives, insurance incentives, as well as the technical assistance, the engineering expertise that people need to build safely, so that we can, again, use the private sector and use insurance and finance to create incentives for safe construction.
Great. Well, first, I told you I'd love to put you in touch with our team in Endeavor in Chile that helped mobilize the business community after the earthquake in Concepcion. So I will commit to that. I want to take the last little moment here to thank CGI, because I think there's so much talk about startups in both the social and the for-profit sector, and I'm a big believer in scale-ups. And I think that this is the hardest time, especially in terms of financial support, after you've been around 10 years. You've proven a model. You have all the learning. So I just want to commend CGI, but tell everyone here, I mean, this is exactly the type of thing. She's got what it takes. I think the financial support is really the missing piece to be able to allow you to replicate. So I just want to make that plug.
Thank you very much. Thank you. Nice job. Terrific. Okay, thank you, Elizabeth, so much. Okay, well, thank you also to our panel. Now, there's time for a little bit of sprinting around the room. Let me just explain how this is going to work. We are going to distribute our pitch makers around the room. So over here, we're going to have Crispin from Copia. Here, we will have Sashi. These tables at the back of the room you can see here from Upaya. Over here, we will have Amanda, who is from Rice, as you know. Elad will be in that corner there, and Elizabeth over here. If you can kind of run around, if you've got something to help them with, there are goldfish bowls you can drop your cards in. You can use the mobile app to give them some feedback. Want to give you the maximum time we have, which will not be very long for that. But thank you very much, panel. Thanks, pitch makers, and thank you, guys.